The forced swim test is no summer prank. It's a hideous test used on animals that cost taxpayers tens of millions of dollars and do nothing to advance science. But now scientists in the labs are beginning to concede PETA's point. That's next on the PETA Podcast. Welcome to the PETA Podcast. I'm Emil, Guillermo, your host for this behind-the-scenes look at PETA, the largest animal rights organization in the world. Here we talk to the key players at PETA and the movement and ask them about how animal rights change their lives and how they stay motivated to make the world a better place for the animals. On today's episode, scientists are coming around to see that forcing animals to swim to see how long before they give up is just plain bad science.
Typically, the mice or rats, the animals don't die during the procedure. They're being observed by an experimenter and they'll swim. And then after a set amount of time, they'll get taken out of the water or they'll get taken out of the water if they start to sink. But unfortunately, that's not always the case. Experimenters conducting this test and not really paying attention and animals drowning because of it. And in really early versions of the test, like in the 1950s, the point was to make the animals swim until they drowned.
Dr. Emily Trunnell of PETA says 4 major pharmaceutical companies have answered PETA's call to end the cruel tests, but some big ones like Pfizer, Bristol, Meyers, Squibb, and Eli Lilly are still holdouts. How can you make Big Pharma end cruelty in their labs? Next on the PETA Podcast. But first, thanks again for joining us here at the PETA Podcast. Please share a link with friends. Let them know the animals have a voice on the PETA Podcast. And if you just found us, welcome. And keep binging. There's lots to listen to on the PETA Podcast. How to become vegan, how to stop the cruelty in horse racing, the latest on SeaWorld, what Ingrid Newkirk really thinks. Go to PETA.org and find our podcast there or on the podcatcher of your choice. Remember, if you're on Apple Podcasts, don't forget to rate and review the show. It helps the algorithm know that PETA has a podcast on the issues important to you. There's also a link to a survey in our show notes if you're so inclined. We'd love to hear your feedback. And now, if you really want to help the animals, you can always hit the Donate Now button at PETA.org. And if you're high-tech and have Amazon's Alexa, it's as easy as saying, Alexa, donate to PETA. And now to our episode. NIH could stop the use of forced swim tests, but they don't. But these days, more scientists are realizing that the forced swim tests are bunk, and that includes commercial scientists as well as academic ones. When major scientific journals begin reporting the development, it marks the beginning of the end when mainstream scientists start seeing that PETA has a point, that animal experiments like the forced swim test must end. To explain the test and the progress, I spoke with PETA's Dr. Emily Trunnell on the PETA Podcast.
I guess it's a big deal that major publications, scientific publications, have written about these forced swim tests and what PETA has done to try to get these eliminated.
I think it's a really big deal that this is being brought up in Nature and the scientists. That the forced swim test is just, bunk science. And I think it just speaks to the fact that, as we're seeing more and more these days, scientists and PETA are agreeing on a lot of issues when these tests aren't working.
Now, tell me about the forced swim tests again. I mean, we've talked about it. We've done interviews about it. But for people who are just, coming to this one podcast, what exactly is the forced swim test and how does it work?
So the forced swim test is this experiment that scientists have used for a long time. And what happens is they put a mouse or a rat or sometimes a hamster or gerbil or guinea pig into a beaker of water. And then they measure how long the animal swims and versus how long it takes for the animal to sort of stop swimming and just start floating. And sometimes before this, they'll inject them with a drug that they're interested in. And the idea is, that's false, but it's the idea that keeps being perpetuated, is that the more an animal swims, the more they want to survive. And when they float sooner or float for longer, they've given up or in despair. But really, that's just kind of silly when you think about it. I mean, when an animal stops swimming, they could be, conserving their energy. Maybe those animals who float sooner are better adapted to survive because they realize, okay, I need to conserve energy. I'm just going to hang out here for a minute. So it's just really kind of bad science, and it terrifies the poor animals who are just swimming to try to keep from drowning.
So the animals that are used, what kind of animals? It's generally a mouse, is it?
It's usually mice and rats for this experiment, but there are some experiments that have been done using hamsters, guinea pigs, and gerbils. So small animals that they can fit in a beaker of water.
And so they drop the animal in there, and does the animal die, or is it in any danger, or is it just the fact that they're being observed to see how actively they try to survive and swim?
Typically these days, the test is conducted for anywhere from 4 to 12 minutes, and typically the mice or rats, the animals don't die during the procedure. They're being observed by an experimenter, and they'll swim. And then after a set amount of time, they'll get taken out of the water, or they'll get taken out of the water if they start to sink. But unfortunately, that's not always the case. We've read reports of, students or experimenters conducting this test and not really paying attention, and animals drowning because of it. And in really early versions of the test, like in the 1950s, and the point was that to make the animals swim until they drowned. Fortunately, that's not how it's conducted anymore. And when animals drowned, it's by accident, but it wouldn't be an issue if they weren't doing the test in the first place.
So the articles in these major publications that were just published, I mean, PETA's against these experiments, have been fighting against these experiments. But what was the upshot of the articles? Was it just reporting on what PETA has done to try to stop them? Or did they take a stance and come up to the point of advocacy to expose that these tests were bunk?
I think that the articles really showed that PETA has been right on the money in criticizing the forced swim test, and that the general scientific consensus is that, one scientist is quoted in the article as saying, we shouldn't be using this test anymore. They're just bad science. So I think it really shows that this is a general consensus among scientists that these tests are overused and don't show us anything about human depression or human psychology. So I think that's really important to show that there's cohesion in the thinking on this.
That the scientists and animal rights groups are seeing eye to eye on this. Is that really something new? I mean, that usually doesn't happen, right?
It's actually happening more and more for scientists and animal rights groups to agree on these issues. We're seeing that the more data that we get about animal experiments and whether or not their results actually lead to treatments for humans, it's becoming clear. Animal rights groups have been saying all along, we have an active interest in advocating for the animals, and we've been bringing up these issues for a long time, not only the ethical issues, but the scientific issues with animal testing. And now that we have much more data to show how the animal experiments are failing, we see more and more that scientists are in agreement, especially when it comes to silly tests like this.
Do you think it's a generational thing? Scientists are smarter, better, less bound to tradition? Or do you think that science has just really advanced? It's gotten better and people see that these methods are just antiquated?
It's probably a little bit of both of those things. Science has come a long way in what we can do molecularly in the lab to mimic human tissues and human organs, and to use human data. And so I think, with those advances, scientists are really like, oh, we can do this other ways. We don't have to keep using animals. And there's much more investment in those methods than there used to be, which is the most important point. And, these new generations they want to get things done. Older scientists have built, 50, 60-year careers on using animal experiments. And, these newer scientists are coming in saying, we just want to do things right from the beginning. And we have all these tools now. So we don't have any allegiance to these old animal tests.
Well, you also said a word just a second ago when you talked about the investment in this process or the investment in this test or the investment in this old way of doing things. And I mean, that's sort of what you're fighting with, what PETA is fighting, that people sort of dig in and they make it a fight to bring about change.
Exactly. I mean, currently the NIH, we did just a quick search on the NIH's own website for grants that are active right now, where scientists are using these tests that we've targeted. And it's over 24 million. And those are just active grants, that the NIH is putting into these experiments that we see from the articles. Scientists are in agreement that they're useless. And so that's, this is money that really needs to be spent on human relevant methods. I mean, we're talking about research for depression, which is something that, anywhere from 13 to 20% of the U.S. population suffers from. It's a huge issue. So we really need to be putting our best foot forward when we're using our nation's investment in biomedical research to try to get treatments for depression.
Well, we'll talk about what the forced swim tests or how they were used by the pharma companies.
The idea was these pharmaceutical companies, and we've done research and have their papers showing where they've done this. They inject a mouse or a rat with a drug, and they're looking at that drug to see could this be a human antidepressant. And if the mouse, after the mouse has been injected with the drug, if they swim for longer, supposedly they're less depressed. And then maybe that drug could be an antidepressant. But what we found, we pulled papers from four major pharmaceutical companies, and we're working on more data for this. But what we found is that these drugs that these animals had been injected with, they didn't end up going on to be human antidepressants. They weren't actually effective when they were used in human clinical trials. So the pharmaceutical company's own data was showing that the forced swim test was not, the way it's being used, it's not predicting whether or not we have a new human antidepressant.
Well, what do the drugs end up used for?
A lot of them just, they fall by the wayside. They go through these animal tests and they look good in the animal tests and they go to human clinical trials. And in psychological research specifically, 92.8% of drugs end up failing when they don't get FDA approval. So, this is just a lot of wasted time and wasted money on relying on these animal tests to try to show us what happens in humans.
Is there a breakdown between the commercial interests, right? The scientists who are for the pharma companies and the other people who might be, for lack of a better term, pure researchers, unconnected with the commercial interests?
There could be. I think, this is the fact that the forced swim test is pretty useless science is kind of well recognized across the board now, which is why, after PETA has contacted several pharmaceutical companies, they respond and say, actually, we're in agreement with you. We don't need to use this test anymore. We're going to make a policy against it. So it's pretty across the board. These pharma companies have used the test. They've seen themselves it's not worked. They looked at the data that we presented to them. And they realized that, this is not the way to go forward. So it's pretty across the board.
Well, tell me about the companies that have done the forced swim test and then are no longer doing the forced swim test. And then tell me the companies that are still doing them, no matter what anyone says.
After speaking with 4 major pharmaceutical companies, they've agreed not to do the forced swim test anymore. And those are AbbVie, which is formerly Abbott Laboratories, Johnson & Johnson, Roche, and Boehringer Ingelheim. Mm-hmm. And these are, huge Fortune 500 companies. The first 3 are in the top 10 of pharmas by revenue and are in the market of producing antidepressant drugs. So they've, even something that they're actively doing, trying to develop these antidepressants, they're saying, we don't need to use the forced swim test. It's garbage. And then, unfortunately, there's been a few pharmaceutical companies that just won't commit to banning it for some reason or another. And those are Pfizer, Eli Lilly, and Bristol Meyers Squibb. They can't seem to get their head in the game.
And those are big companies. I mean, it's laudable that the top 4, AbbVie, Johnson & Johnson, the top ones that you mentioned who have changed, that's laudable, yes. But the fact that Pfizer is still in the game, Bristol Meyers Squibb,
Pfizer, and Eli Lilly.
And those are also top names that they won't budge. What's going to get them to budge?
I think they're just going to see that they're falling behind the times. I mean, almost every time I think they're just going to see that they're falling behind the times. We write to a pharmaceutical company and, we get agreement with them and their competitors who are going to stop using the forced swim test and use more human relevant methods to study depression. They're going to be the ones that succeed in the market. And hopefully it won't take Bristol Myers Squibb, Pfizer, and Eli Lilly that long to realize that they need to go ahead and ban the forced swim test. But if they don't, that's what they'll see.
There is this sense that, well, maybe they just don't care. Maybe, they're doing well. They're making their millions, if not billions of dollars. For them, another test is just as they say, a CYA type of situation. At some point, they don't care about the animals.
It seems that way. If they're not willing to take this really easy, make this really easy policy decision to ban a test that scientists and their competitors are against, I really don't know what they're thinking. They kind of don't want to be caught up in making really specific decisions about tests, but I think that's going to be to their detriment.
We talk about the commercial role, right? The big companies, the Fortune 500 companies. But what about the role of NIH, the way they fund and the way, they set the tone? It's not really the pharma companies totally.
I think it's both. NIH is a major player here. They are the biggest funder of biomedical research in the world. And as I mentioned earlier, they're funding, over 24 million active grants right now to use these tests. And we've written to NIH and specifically the National Institute of Mental Health, which funds the majority of these kind of experiments, and asked them to stop conducting the test themselves, which they've done and do, stop funding the test. The scientific consensus is there, and if they did, that would set really a huge precedent for other researchers. Farmers are jumping on board quicker because their bottom line is really what is on the line if they use bad science.
It's getting it from all directions. If the NIH was on board, then certainly that would hasten a move by a company. If they see their bottom line hurt, of course, that's going to hasten the move. If maybe shareholders revolt and start voting some resolutions, that could be a part. And I guess PETA's been a part of all fronts, trying to push these companies to do the right thing.
Yeah, PETA is attacking the forced swim tests on every platform that we can. We don't want to see mice and rats have to fear for their lives and swim to keep from drowning for a test that there's so much agreement about, but it doesn't work. And we are shareholders in these pharmaceutical companies, the ones I've mentioned that are still doing the test, Eli Lilly, Pfizer, and Bristol Meyers Squibb. We've gone to their shareholder meetings and presented this issue and at those meetings, and they're still refusing to budge. They're just being, very stubborn about the issue. And so we're going to keep at them.
You also talked about these mice and these rats. And I know that there's some people who listen who are, of course, sympathetic and empathetic, but then there are others who say, oh, what's a mouse? What's a rat? And yet PETA has been responsible for saving millions of these lives, and it's not insignificant. And yet there's still this attitude out there. What do you tell those people who have that kind of sense that, it's just a mouse. Come on, get real, PETA.
Unfortunately, sometimes it's hard to get people to care about mice and rats, but these are obviously people who have never met a mouse or a rat. They're very curious and intelligent and sweet animals. And they, just as much as we do, they feel fear and pain and desperation. And, no one who has that ability to suffer deserves to be treated like this.
And that kind of leap sometimes is hard for people to make. And because it's a kind of speciesist thing, it's a kind of size thing. I'm bigger in the animal kingdom. How do you bridge that gap, you think, with when you try to reach those people? Or do you just try to find the people who do see? I mean, it's science and it's money ultimately with some of these companies. But what is your role, you think, as a scientist and an activist in terms of trying to convince people to see things the way you see them?
Well, even science itself is showing more and more how mice and rats and all species are, sentient, show empathy, feel fear. The science is there on these issues. And I think, the more we can talk about this and demonstrate that, I think, people are coming around to mice and rats. And we're going to keep advocating for them. With these tests, like you said, it's just, even if nobody cared about mice and rats, it's using these tests is not benefiting human health or human depression research. And that's another huge reason why they shouldn't be done.
We've talked before, and people who are listening can listen to my interview with you on the podcast about why you went from a researcher, from a person who did these tests, to an activist at PETA. And I just want to put things in perspective. This is a major thing. Each company that you get to stop the forced swim test is a major thing. How does it make you feel as a person who was once an animal researcher and someone who tests on animals? You were a vivisector, and now you are doing this. How does it make you feel, and how does it reinforce the choice you made when you left your old life and became a full-time animal rights activist?
I feel sad when I think about my time doing experiments on animals. And, I wish I knew then what I know now about animal research and about vivisection and about these tests. I would have done things differently, but I'm glad that I now have the voice that I do to be able to speak out against these tests. When I was in graduate school studying neuroscience and doing vivisection, the forced swim test, for example, is something that always came up as my advisors would criticize people using this test, and we would talk about how silly it was. And so to get a chance now to, not just talk about it, to get to make a difference for these animals and save future mice and rats and gerbils and hamsters and guinea pigs from, having to swim to keep from drowning for no reason. That's really satisfying to me. And I feel grateful to be able to do it. And I just hope I can somehow counteract the harmful things that I did in the past by doing the right thing now.
And I suppose that even though you've got these nice write-ups in the scientific journals, and you've got companies that have have agreed to get rid of this forced swim test, you still have a fight ahead. There's still some other companies that you've got to get to.
Yeah. There are still companies that refuse to ban this test: Pfizer, Eli Lilly, and Bristol Meyers Squibb. And PETA's going to keep after them. And our supporters can go onto our website and make their voices heard too, and write to these companies and say, please ban the forced swim test. Get in line with your competitors and the rest of the scientific field, because this is just junk.
Emily, thank you very much for being with us on the PETA Podcast.
Thank you, Emil.
Dr. Emily Trunnell with PETA's Laboratory Investigations Department on ending the forced swim tests and how more and more scientists are seeing eye to eye with PETA as it realizes that the bad science only hinders its main focus in developing more effective antidepressants. For more, go to PETA.org. And that's our program. You can contact us at PETA.org. You can find me on Twitter at Emil Amok, that's EMILAMOK, or on ALDEF, AALDEF.org/blog, or on my website, amok.com, AMOK.com. Hey, and if you're in D.C., incidentally, please come check out my one-man show, Emil Amok, at the Capitol Fringe. Once again, thank you for listening. Check out all our episodes on Apple Podcasts, where you can rate and review the show. It helps get the word out about the issues you care about. Music is provided by Carbon Works. Check them out on YouTube. Thanks again for listening. Join us again next time for more insight into animal rights and the fight for a cruelty-free world on the PETA Podcast. I'm Emil Guillermo.